Hi everyone, I'm Steve Main, here again with our weekly interview with Dr. Nario. As you know, Dr. Nario is at Biointegrative Health Center in Reno, Nevada. You can check them out online and see what they're all about. So, welcome, Doctor.
Hi, Steve. Always a pleasure again being here. Always happy.
So, we've been doing a little series on something that we're getting a lot of questions from patients and people who have subscribed to the channel about UVBI, ultraviolet blood irradiation. So I'll let you just describe it again briefly, and then we'll go into a couple questions that people have about it. And they're getting more specific on their questions, but tell us again briefly, what is it?
Yeah, Steve. Well, UVBI is something that is now being a hot commodity here in our practice. And you've seen it, people are lining up for it. And the thing here is, again, with UVBI or the ultraviolet blood irradiation machine, it is combined with ozone. But let's focus on getting to know the bits and pieces of this procedure. So UVBI, again, this was actually personally stamped by Harvard's biology center. And this is Dr. Michael Hamlin, who actually endorsed it and said even ultraviolet blood irradiation is extensively used even in the 1940s to 1950s to treat many diseases, including infections, arthritis, asthma, and also he recommends it to be actually be investigated more, meaning add more funds in the Harvard vault so that they could actually do more investigations on this. And you know, Harvard is one of those standardized type of facilities and conventionally kind of ran. But again, as he saw the light and the potential in this therapy in addressing many health issues, and again, UVBI is composed of so many lights, which are actually three lights: the UVA, UVB, UVC, and in just I guess in a nutshell, UVA and UVB pretty good to modulate your immune system and the blood cells that are running through that cuvette, and the UVC, the one that kills infections.
Okay, so I had the treatment last Thursday, and it's interesting. I felt pretty good after it. You know, they draw the blood out, a lot of it, and then they put it into this tank and bag, and then they treat it with the lights and the ozone, and they put it back in you. So that was my simple explanation of what I got. So here's the first question from people out there, from someone out there, and the people out there listening. Here's one of the questions, because I've heard this is really good for pain, and I've heard positive testimony about what it's done for people with pain. So, first question: can this help UVBI? Can it help with arthritis?
Oh, Steve, that is one of the more common findings that I've seen here in the clinic. That even with one therapy, a patient starts to feel that it may not be a complete removal of pain, but I have seen it. It definitely decreases the pain level, and you have to remember, pain is stimulated by inflammatory markers. And I don't want to bore everybody with the jargon, but one of them will be like, for example, TNF alpha, and as it gets higher and higher, it blocks the circulation, thus accumulation of lactic acid in specific areas. It's also decreasing the nitric oxide, which vasodilates blood vessels and which promotes blood towards different organs. And the thing here is when you talk about immune system, or I'm sorry, inflammatory conditions, you talk about also the immune system. That's why again, where is the main star of this therapy in terms of the lights? The UVB light is the one that actually helps with this inflammatory process. And again, it activates the bad inflammatory cells that promotes the bad inflammatory enzymes to be produced. And again, we have also UVA as part of this. that regulates. It's like the maestro of cells to tell everybody to calm down and not create all these inflammatory enzymes to balance, again, restoration and regeneration.
Okay, so this treatment helps people with arthritis by reducing the inflammation. Is that correct?
Yes. And again, even the production of enzymes that produces inflammation.
Will it help in the long term by doing this treatment more than once? Will that help the arthritis maybe even go away?
Right. Well, you have to understand if there are actual structural abnormalities, there has to be a specific approach for that. For example, if you have a herniated disc, I mean, even with the most treatments that the most ozones that you can get in UVBIs, you definitely still need to go into that specific problem to fix it. But again, as I see patients who does not have these structural abnormalities, the inflammation just goes away. I mean, instantaneously.
Hmm.
And some may be needing more treatments than others, but first therapies always kind of gives you that push.
Okay, so here's another one that I hear the buzz around that it's helped. So, next question is, can UVBI help allergies?
Well, Steve, now again, there's still the season of pollens and grasses flying around our environment, and I see a lot of them. And again, I have seen UVBI with ozone to kind of help these patients who are experiencing these bad allergic congestive symptoms. And why is that happening? For the reason that, again, same UVB, UVA lights, they function to control the cells that releases allergic allergenic responses to our system. Meaning, again, telling these cells to like calm down, don't respond so bad, so that we would not be more producing more mucus in our respiratory tract. And it also modulates these other cells to promote an anti-inflammatory condition for the patient rather than being in a pro-inflammatory state. So UVA and UVB lights are pretty good to restore the balance of these what we call, and to be more specific, the eosinophils, the IgE production. They are all going to be well regulated, and mast
Okay,
cells.
so those particular lights treat the blood, which helps the symptoms. Is that right?
Right. So you have three lights there in that machine. So that's why these two are the ones that are really, and pertaining to our subject right now, are actually the stars of the show. Because a UVC, A, B, and C, UVC is special in regards to infections.
Okay, one more. And there's going to be a lot more questions on this topic for sure. But can it help conditions like autoimmune diseases, like fibromyalgia? I mean, if inflammation, I mean, I'm not the doctor, but I would think that that would help fibromyalgia or different inflammation type things. But what about autoimmune disease and fibromyalgia?
Right. So, Steve, they basically are in the same category. Fibromyalgia, it's because of cells that our own body creates, and it ends up attacking our own muscles and our joints and ligaments and tendons to produce pain. And again, with UBBI, again, I'm going to focus it more on the A's and the A and B, because it actually again is modulating. The maestro is going to tell all these cells, hey, don't eat self, don't fight self, you have to recognize it, and you should probably just be focused on fighting external infections, for example, or pathogens, rather than eating its own. And also, when you talk about these abnormal cells that we create in our own bodies when we have an autoimmune condition, there is what we call they contain more biophotons, meaning they can absorb more light compared to normal dormant cells, which are not overactivated, which is causing the autoimmune disease. So when these abnormal cells are very active, and as I mentioned, they pass through these UV lights, they absorb more light compared to normal cells. So by absorbing more, this destroys them or calms them down and modulates them for them not to aggravate the autoimmune illness. And some of the autoimmune illness that I've seen that actually have benefited from this, and just as I say, some, because there's so many: fibromyalgia, lupus, RA, psoriasis, Raynaud's, scleroderma, even MS. So there's more to the list, but those are the most prominent ones in my experience.
Wow, this treatment does a lot, and it definitely sounds like it's reducing pain in many different types of issues. So, um, if you guys want to find out more about this treatment, anyone listening, you can call Biointegrative Health Center in Reno, Nevada. You can also check them out online. If you're not in the area, there's a multiple other clinics that do this treatment, right, doctor?
Yes, Steve. So this is a technology that's already out
Yeah.
there, and you just need to find that competent and safe practitioner or a practice that will administer it for you. And again, as I said, this is not really old technology, but it's been there. There are new updates about this and upgrades, and in the future, we will be keeping you posted about that. And again, we will offer that in the practice, since we actually saw the best potential out of this therapy, and upgrading what we have right now is definitely worth doing for our
Yeah,
patients.
so there's more good stuff coming. But if you guys want to know more, do some research, reach out to some of your local physicians here who have been doing this treatment. Some of them may be doing it longer. Or if you have questions, put them in the comment section here in this video, and maybe Dr. Nario can point you in the right direction. So we're here to help, and we thank you, doctor. This is a great treatment, and I'm still learning more about it and doing it. So Dr. Nario, Biointegrative Health Center, Reno, Nevada, thanks for being with us as always.
Well, Steve, thank you again. As we all know, knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.